see a lot of familiar faces, and that's very comforting. Takes away all my anxiety. Thank you for coming. I'm looking forward to today's seminar, and it's very hard to get out of seminars. I'm not just as a speaker, but more so as somebody who comes to listen. So when I get people, I try not to do too many seminars, it's a lot of effort, but when I do a seminar and I get all those people, I feel obligated that I have to do a good job. Just like I'm about to do a facelift, I have to do a good job. Because people have taken time out of their busy routine with their family, kids, shopping, nails, mani-pedi, whatever. So all the important stuff. So I'm going to make sure that you get your money's worth and educate you really well today, so you don't have to go to another seminar on facelift ever again. That's my goal. So without further ado, we'll get started. The video that I showed you earlier, that video is on YouTube, and it's a good way of showing you what to expect. For the longest time in my practice, patients would say, well, what am I going to look like? And I would tell them a little blue, a little red, a little green. I had no idea how to explain. So a picture is worth 1,000 words. That's the best way. Now all I say is, I don't know, watch the video and see what you're going to look like, and that makes it very easy. So that's a great resource for any of your friends who say, what should I expect? Tell them go on YouTube and just search Journey of a Facelift, and they will get to see it, and that answers most of the questions. Okay, the very first thing is that we always want to know is why are we here today? Why do looks matter? And it's a very important question, because why are so many other people not here? Why are we here? Because I think looks do matter because we have an innate sense of beauty in our brain. It's part of our DNA. We like things that are beautiful. We like beautiful gardens, beautiful houses, beautiful paintings, beautiful people. And it gives us a pleasure, an aesthetic pleasure. And there's something to be said about it, and it extends to our faces as well. And that's the reason behind it. That is the number one reason. Next reason is that we're living longer, we're living healthier lives, we look, we feel very good and young. And I've been told that by many patients, listen, I feel great. But when I look in the mirror, it just doesn't match. That's the problem, because we were designed to die at 50 or 55. That's what it used to be, but now we're living up to 115, 120 in some cases. So that is a big mismatch, and we have to try to keep up with our age in terms of our face, matching the age that we feel on the inside, not the number itself. Next thing is relationships. It's very important, to look good for yourself, but also for your spouse, your partner. And not only that, these days, there are a lot of born-again singles. Either you become a widow or widower, or you get divorced, and now you're back again. And it's not easy being back in high school again where you're trying to date. It's very tough. It makes life very hard, and that's why there's nothing wrong in trying to put your best face forward and trying to show the best you have. This way, hopefully, you find the mate of your dreams. That's only reality. Self-esteem. Self-esteem is an important thing for everyone, but I have found and realized that more so for women, they place a lot of emphasis on their looks and their own self-image in terms of their self-esteem. And there's nothing wrong with that. Men do it in terms of their health, their vitality, the money they bring in, their career. That's their strength. So when I'm successful, I feel empowered. I don't need to do makeup to feel empowered for my self-esteem. Women, my wife, she has to do the makeup. She feels good. She doesn't have work, but she feels good by looking good. And that's the way men and women are different. So it's very important to keep that in mind as well. And the last thing is very interesting. Unfortunately, as the economy went down, I got to see more and more of this phenomenon where people literally came and they would come and say, listen, I remember one of my sweet patients, very nice lady, she said, I want you to get started now and get me ready by January 1st. It was around Thanksgiving, and I said, really? Do you have a big wedding going on, or what's going on? She said, no, I just found out I'm going to get laid. My office is laying off a lot of people. I'll be laid off very soon. I'm like, shouldn't we celebrate? And she said, no, I want to look good when I send out my resumes January 1. And we worked on her. She did great. She got a job. She's happy. But that's becoming more a phenomenon. And now these days, if you go apply for a job, you got 10 other people way younger than you. And guess what's going to happen? The very first thing is going to kick in the mind of the person who's interviewing you. I've interviewed people for jobs, and trust me, that innate sense of beauty takes over in your mind. You might not be a biased person, but when you see somebody stunning walk in, for a moment, unconsciously, you're like, oh, she would look very good in the front desk. You're not even thinking, but it's happening. So trust me, these things matter. So when you got a job competition going on, or just trying to maintain your job, it definitely makes a difference. The guilt. This is a big issue. I see a lot of guilt, and I don't know. I mean, not everybody's Catholic, but a lot of people unfortunately have this guilt they carry. So I have to get them over it. I mean, and I'm talking about my first-time patients, not my regular ones. I've broken them in. Trust me. There are many in this room, and they finally have no guilt. That's perfect. And typically, like, I'm not vain, but it's like vanity's okay. We all want to look good. I'm happy with the way I look, but well, that's great that you are happy with the way you look. But why don't you want to maintain the looks? Let's maintain the looks. I never thought I would be here. Well, now you are, so let's get over it. This is my favorite one, all the husbands, cover your ears, please. My husband does not approve of these things. And I say, that is awesome. And I'm like, what? You know what? You go home and you say, honey, guess what? And the husband's going to say, what? Honey, you should never get a facelift because you don't approve of it. Perfect answer. Done. Argument over. You don't have to worry. The fear. I really don't want to look like. This is amazing. Unfortunately, the media has made it such a problem for all of us. We always think that when you go to a plastic surgeon, you're going to come out looking like Joan Rivers. I'll be honest with you, even if I tried, I don't think I would create a Joan Rivers. I mean, really, it's nearly close to impossible. So I give credit to the plastic surgeon who did it, because it's not an easy job at all. You can't do that. That's not reality. And, you have to be conservative in reality, and a good job will never be shown in television. And that's the norm. Joan Rivers is not the norm. Those big lips are not the norm, so never be afraid of that. Usually it happens when somebody, especially a celebrity, is pushing a surgeon. They're pushing them like, okay, do more and more, and you can't really say no to them. It's very hard. So you feel pressure and you probably do that. That's the issue, so that's not an issue at all in terms of normal people coming to my practice and looking weird. Last thing is anesthesia. Anesthesia is not like it used to be. In the past, when we were young and growing up, we used to hear of so many people, oh, he went to an anesthesia and never woke up. I see a friend of mine sitting here, a nice lady from Russia. She grew up in Russia, I grew up in Pakistan. We used to have tons of stories of people who would never wake up. They would go to anesthesia. It was scary. I remember my first surgery, I was really scared. I thought, this is it, game over. I've had 3-4 surgeries since then, and I did wake up. So that's not an issue. Don't be afraid of anesthesia as long as you're healthy. The age dilemma. This is very important because, people come and say, I really don't want to start doing this stuff at my age. And I'm like, okay, so what's your age? Well, I think I'm too old to do anything. And I'm like, okay, so let's say you're 75. Yeah, I'm 75. So, well, you might live to be 105, and that means 30 more years, so what do you think? Well, I guess we should start. Next, I think I'm too young to do anything. No, you're not. Most of us are here because if we had been doing everything that's available right now today, we wouldn't be here in this room. The young people who are starting out are the ones who are very smart, and they are doing things early on and they're maintaining their face. And they will not have any issues for a long time. And many of them will never need surgery probably because they will maintain their face going along like they're supposed to. I have a few young patients like that in practice, and they always ask me, am I doing the right thing? Because they're the only few ones. I'm like, you are being very smart. Keep doing it, keep maintaining it so you don't have to do anything radical. Last one is I'm just waiting for my 50th birthday. That's my favorite because I'm like, 50th birthday? I've been trying to find out like what is the deal with the 50th birthday? It's like, is it like a special 50th birthday fairy that comes out and says, oh, 50, oh my God, everything's going to be just fine. There's no number. You start when you're ready. It's never too late, it's never too early. Just do the right thing. That's all. The financial dilemma. It is hard. It absolutely is. A lot of patients come and they always say, I am not your regular patient. And I ask them, when you walked in, did you see a lot of Bentleys and Rolls Royces lined up there? I'm like, you are my regular patient. Everybody is. I have patients who are waitresses. They save their tips to come get Botox. And I do have a few who drive Bentleys and they come in and money's not an object. Time is. They need to be in and out. So I cater to all of them. And that means you are all my regular patients. I don't want to get hooked onto Botox. And my answer is, do I look like a crack dealer? It is not hooking on. If you can't afford it, you stop doing it, you'll be fine. You won't be like shivering like, oh, my Botox, my Botox. You can't, don't worry about it. It's okay. It's okay. And honestly, God, I had a family friend of mine, I wanted to give her free Botox, she wouldn't take it. So I'm like, okay, I gave up. I'm waiting for the market to come back, financial dilemma, I understand, and I always say, you're right, and I'm like, good luck, me too, I've been waiting for that too. The reality is, if you carry a mortgage and a car and a credit card, probably you have good credit, you can afford to do it, but it's a choice, you have to make a choice. It's all about choices in life. Honestly, I'm standing and giving you all this lecture But I haven't fixed my nose. I would love to. Now that I've admitted I have a crooked nose, but I just don't have the time. And I haven't made it a priority. The day I make it a priority, guess what? I already know my friend who's doing it. I already know what I'm doing, where I'm going. It's just I really haven't made it a priority. I have excuses. Oh, kids are busy. I'm just busy with the practice. It's excuses. That's what it is. When you're ready, you know it. Then just do it. So this is what happens at the end if you keep waiting, waiting, and waiting. Because this lady had no idea. This is the first time she's looking in a mirror. So she was in for a big shock. So you can age naturally, but that's what nature does, unfortunately. Nature is not very kind. So when this happens, what do? So these are all the things that lined up. These are, trust me, only 1/3 of the total names that you will come across if you start searching the net. They just go on and on and on, and at the end you see the poor real facelift who's crying saying, I am the facelift, please look at me, I'm the real facelift. Nobody's paying attention. So these are all the mini facelifts. Let's go through it quickly one by one. Lifestyle lift. I'm sure you've seen the ads, and the ads don't make you feel that you are going for a surgical procedure. And that is very deceptive, unfortunately, because it is a mini facelift. That's exactly what it is. And it's done by a lot of surgeons who come in as just like weekend workers. They come, they do it, and they go. It's not their practice, so you're getting somebody who's just per diem coming to do it and they go. And I could sign up for that if I wanted to. They would pay me a cut, I'll go do it there, and I'm done. But there's no follow-up, so unfortunately that doesn't give the continuity of care that you need with these kind of things. It doesn't give you the standardization that you need as well. Short scar lift means basically they tell you it's only a small scar. The reality is the difference in length between a real facelift scar and a short scar is maybe 2 inches. That's about it. But they make it sound so that you don't feel afraid, like, oh, I'm going for a short scar. What about you, long one? I don't know. I think I'll stay with the short cut. It's a lot better. O-lift is a doctor with the last name O something, so he made it O-lift. I don't know what the difference is. MAC, M-A-C-S, max lift. This is a very tricky word. It stands for minimal access cranial suspension lift. And I like to be on top of everything in my literature, so the moment I saw this, I was like, wow, I gotta look it up. I looked it up, I ordered the video from my academy up, I sat down to watch it. I was like, this is gonna be really nice, like voodoo magic, cranial suspension, like little dolls hanging out, like, you pull it up and you're like, wow. I looked at the thing, it was twice as complicated as a regular facelift. And took twice as long to heal. I was so mad, I wanted my money back, and the academy, they won't give it to me. I was like, I don't want to do this to any human being. But that's another mini lift. S-lift. S-lift that's not listed here again is a mini lift, named after a doctor's name. Skin only, what that means is it's only a little bit of skin and that's it. 2-3 years down the road and you're back to where you are. O-lift on the doctor's show, that's the doctor's last name again. And it's a mini lift, but it's shown as like a really major lift and it is not. Lunchtime facelift. Anybody know what a lunchtime facelift is? I'll tell you what it is. It's when you're having a lift while somebody else is enjoying your lunch money. Because it doesn't do jack. And there are many more. So let's go on to the other ones and talk about something a little more serious. This is a serious advance. So in our literature, if you're talking among surgeons, we always say, like, what is the latest thing that's happened since 1970s? That was a new thing, deep plane facelift. A wonderful new thing that started, and I've done deep plane. It's a wonderful lift, but there's a problem, 2 things. Number one, there's a danger to the facial nerve, and that's the number one thing that we as surgeons are really worried about when we are in the operating room doing a facelift. Many surgeons won't tell you that because they don't want you to be afraid, but trust me, if somebody's awake at night after a surgery, that's because a patient woke up and the chin was not moving and thinking, God, did I bang that nerve or not? So that's the one condition. And that's the problem with deep plane. You're very close to those nerves, and you can hurt them easily, and that's the last thing you want. Next thing is swelling. If you're going in deep planes, pulling a lot, you cause a lot more swelling, and that swelling can take a very long time to go away. It's not worth it for most people. So this is the area, and I'm going to just quickly show you exactly what we do with the deep plane facelift, because you will hear this name again and again. So you can see this is the incision line right there. That's typical of all surgeries. Then we start lifting the skin and going forward. And once we reach this area, we go deep, meaning we go deeper into the tissues, all the way up almost to the lip area right here. Unfortunately, the facial nerve that makes the face move It also gets superficial right around this area and starts going into the muscles everywhere. So when it's becoming superficial, we are going deep, so we end up being right on the nerve branches. And it's very easy to say, oh yeah, it's a piece of cake, I've done 100, I can go in, no problem. Nobody's going to tell you how many of the patients had to wait for 2-3 months for getting it back, or it never came back. Not everybody is that honest and upfront. So that is a big issue, and some of the surgeons will tell you that is the reason I don't do those anymore. And that is the main reason. It can be done, but why would you put your mother at risk for that? Probably not. So why would you do it to a patient? SMAS. SMAS lift actually is just a technical phrase for the gristle type fascia that is in the face, under the skin, and is attached to all the muscles that move the face. So when you pull on that, you're pulling on all the muscles and you're really giving a nice tightness to the face that lasts for a very long time. So that should be part of any good facelift. You can call the facelift any name you want from A to Z. That's okay. As long as you're doing SMAS as part of it, you will have a good result and it will last. L-therapy lift. That's the tightening lift. Has anybody done L-therapy here? I'm glad. Oh, one person. So are you happy with it?
I didn't do it on my face.
Okay, got you. So on the face, the patients that I've spoken to, they have not been very happy at all. It's supposed to tighten the face and make it look like you had a facelift. And honestly, it seems like the only thing you tightened was the wallets of the people who did it, nothing else. So I'm not a big fan of it, and this is after talking to many of the colleagues who basically told me, yeah, it was a waste of my money. And many patients said the same thing, so please don't go for it if you really are thinking about it. It's not worth it, or at least talk to other people who have done it before you jump into that. Vampire lift. I just threw it in there because, there's always a fad, and that's a new fad going around, and most people don't even know that it's not a lift at all. It's basically platelet-rich plasma, your own blood without the red blood cells that they suck up, then they put in your face, the face swells up, it looks a little puffy, you think, wow, it's really refreshing, and next thing you know, boom, it's gone within 2 weeks and you're back to where you were. But at least you got the same thing as Kim Kardashian did, so it must be good. Liquid facelift, that is a reasonable phrase, because patients who are not medical candidates for surgery, and unfortunately there are. It reminds me of a patient of mine. She had passed away a while ago. She was a wonderful lady. She was on Coumadin for atrial fibrillation. She was dying to get a facelift. She could not. I had to explain to her, there's a little language barrier as well, I just can't do it. And she said, even if I stop Coumadin, I said, I don't want you to stop Coumadin, you'll die, you can't. But those are the things that unfortunately, if you get into that situation, or if you had a bad stroke, we can't really offer you that. So I tell patients, if you're thinking about surgery, you're serious, keep your health in mind. There might come a point where it might not be an option. In those cases, I think liquid facelift is a good option where you can use a filler as a liquid to plump up the face. Because when we start at 18 years of age, we are like a grape. By the time we're 85, 90, we're like a raisin. We really have shrunken. So if we can plump up the skin again and make it tighter, it does look like your face has been lifted up. And that's a liquid facelift. In terms of what to use, I'm not a big fat guy. I don't mean like this way, I mean using fat. Fat is great in some physicians' hands, they love it. I personally do not like it. There are two groups of physicians and you're still debating whether fat is good or not. I've seen some disasters with fat. I will let you be your own judge by doing your research. Fat can be overdone easily and there's nothing you can do to get rid of it. I have some patients in my practice that are done elsewhere and they ask me if I can shrink the face. I can't, and you just cannot. So fat is dangerous. Also, there have been cases of blindness from fat injections in the face, so I'm just not big into it. Other fillers are great, but please do not do anything permanent. It always sounds good, like, wow, I'll do it just one time and bingo. That's why people did silicone many a times. There are thousands of people who have had silicone, and unfortunately, silicone is permanent. Face changes, silicone does not, and after 10-15 years, you will be very sorry. And it is not something new. People have been trying different products for a very long time, and we don't have an ideal product as yet, but we're getting better, where we have some longevity and safety at the same time. I like Sculptra, so I'll go over Sculptra very quickly. Full disclosure, because I am a trainer, I train other physicians on using Sculptra, so I do get paid for that, and they are sponsoring part of the dinner today. They didn't pay me for the talk today, but I do like Sculptra, and I've had it in my own face twice. Not lying, it's on YouTube, you can watch it, me injecting myself. I made it for physicians training purposes. Okay, so when you do Sculptra, I'll be quick to this because I want to get to the main surgical facelift. A lot of patients want to know, like, I want to see quick results. No, you will not. I've had many patients who said, listen, I'm not seeing something. What should I do? I said, don't look at your face every second, to see if there's any difference. Look for compliments. You will get some subtle compliments from people over time as you start doing Sculptra, and you'll be like, wow, I didn't realize that. And I've taken some of those comments from actual patients in my practice and put them down on slides. This one patient, she told me, she said, I had asked my husband, because I wasn't sure, I said, honey, how do I look? And that was the year 2010. And, being a husband, he's like, I don't know, I guess the way you did in 87, he didn't realize, he just told her he looked 23 years younger. That's a big number. I have a patient who's a teacher. She was in a conference, and another teacher across the table said, I want your makeup, you look so good. Whatever makeup you're using, I want that makeup. Guess what the makeup is called? Sculptra. I have a patient who's a psychotherapist, and her patient told her, I said, doctor, you don't age. A friend of mine I did, and she had 2 sessions, and she said, I have never looked so good on my pictures. She had some beach photographs that she was showing me after doing 2 sessions of Sculptra. A 53-year-old patient of mine was told by a female friend, said, I guess you must be 37. And then another patient of mine, female, she's 52, and she started having small talk with a gentleman, and the gentleman said, oh my God, you're young. And she said, no. And how old are you? He said, I'm 42. She said, I'm 52. She didn't tell me what happened afterwards. I have no idea. Explaining Sculptra, some people want to know, what is Sculptra? It's a little different than the regular fillers. Sculptra is something that makes you produce your own collagen. So it's like owning something of your own, like a mortgage, not a lease. Whatever you make, you'll keep it for a very long time. And it's like an investment in your face, where if you put it in there, whenever you get extra money you want to put in there, it'll help you. When I see somebody young and they say, what can I do to stay good looking forever? I tell them there are 3 things. So if you have anybody really young, you offer yourself skincare, Botox, and Sculptra. You do those 3 things and you don't have to worry about aging, as long as you do it well and do it right. Last thing is, Sculptra does not disappear very fast. Let's say it's been 2-3 years and now it's going away. It's not going to be radical like a Radius, Juvenum, or any of those, because they just drop down within a month. You wake up and boom, they're gone. It's a slow, gradual change, so you have time to catch up, so you don't feel like I've lost everything. And lastly, it is very subtle, so nobody will know that you're doing stuff, and that is the most important thing for most of us. I'll show you some pictures very quickly so you can see the difference. And that's what we want, nobody knowing what we did. So what is a facelift? Let's get to the actual facelift itself, and that's very important to know because that is going to clear a lot of the concepts today for you. So facelift is 3 things. It is forehead, it is face, and it is neck. Those 3 things are traditionally part of a facelift. What it is not is also very important. For example, it is not a blepharoplasty. That is completely separate. It will not do anything to your eyes. Fine line will not change. You will need laser or chemical peel or something, but not facelift. Sunken look. Also need volume for that. Tightening the face with the facelift will only make it look worse. I came across a facelift. I was looking at my own video of journey of a facelift, and a really scary video came up. If you Google, you'll see it, about my facelift journey of disaster or something. And it was in Harvard somewhere, and the lady was explaining how they did a facelift. First few days it looked great, and then it looked horrible. So I kept looking. I was curious. I'm like, they can't mess up that easy in Harvard. So what I realized is that she had a really sunken face to begin with. She did not really need facelift as much as she needed volume. So once the initial swelling went away, and she saw how unfortunately gaunt looking she was, it scared her. And that's a big thing. So if you lack volume in the face and you do a facelift, you might end up looking worse. So you have to have the right diagnosis. Facelift will not add volume to the face. I had to put a disclaimer on my consent form for facelift saying, please notice that despite a facelift, you might need fillers afterwards. And that's a very important concept that I think all surgeons should explain to their patients. And lastly, unhappiness. It will not fix a broken marriage. It will not fix your child's problems. So that cannot be guaranteed. So please never think it's going to fix all those other problems. So as you can see, the 3 areas in the facelift. One is the forehead, the brows. Second is the middle face and the jowls. And third is the neck. We'll see it from the side view as well, same thing, and these three areas have to be addressed by a facelift. Lifting up the brow, the middle cheeks, the nasolabial fold comes backwards, and the jowl coming back, and the neck bends going back, so you can have a nice angle right here. So this is before, and I've already shown you the video, but I'll show you a day-to-day quickly progression so you can see what it looks like on a day-to-day basis. This is the day after surgery. This patient also had her eyes and a chemical peel. And this is the second day after surgery. Third day without anything, and you can see that majority of the swelling is from chemical peel. Facelift hasn't done much except for maybe a small bruise right there. And then this is sixth day. As you can see that some area has peeled, and she looks okay except for the peeling area, and the bruising has shifted down right there. 1 week after surgery, all the stitches are gone, and she looks pretty good except for the little peeling over here in this area. If she did not have a peel, she could put on makeup and go out on this day. 9 days after surgery without any makeup at all, and you can see the peeling is complete, all done. There's a little bruise left over here, but that's the only bruise, nothing else. This is 12 days after surgery with makeup on, and she looks much better. And you can see the before and after. And everybody's healing is different, but this is, pretty close to what most people can expect. However, I do have some exceptional patients who look really good 1 week after surgery. This is 7 days after facelift. She was happy as can be, and I was pleasantly surprised as well. She did excellent. So I'll go through some pictures to show you. This is one of the harder facelifts because if somebody has a fuller face, then we don't have a lot of skin to pull and remove, and that makes technically a little bit challenging. And as you can see, the patient has a lot of extra skin here, and extra fat and a lot of jowls. So that makes it very difficult. Now I'll show you on the side view. You can see that there's a lot of extra skin and fat right here, and there's no jawline. You cannot see the jawline. Afterwards, you can see the jawline very clearly, and the neck angle is much better. I'm going to pause here because this nice patient of mine is 75 years old, so age is just a number. You can have it done at any age. In the end, I wanted to rush through it so I can open the forum to questions and answers, and no question is off table. I want to make sure that you get answers. That's the most important thing. And I will stay here for as long as I need to answer every single question. But before we go on to that, I want to thank you again. I want to thank also my office manager, Susie, in the back, who's phenomenal in helping me. She's been with me since the beginning of my practice. And also I want to thank Lily, my nurse, and also my videographer right back there. She is the person to keep everybody happy after surgery. She and before as well, but she's really good in guiding you through every process. And before we go on, you might want to know why I do this. Everybody has a reason why to do things the way they do it. I have a reason why I do things the way I do. That's it. So, having said that, now I'm going to open the floor to any questions. Yes?
I've heard from talking to people that have had Sculptra that it left bumps underneath their skin. Not that they could tell visually, but they felt them. Could you address that?
Yes, absolutely. That's the number one problem of Sculptra. Bumps, lodules, lumps. And that is a real problem, and they have not been able to solve it. Unfortunately, it does happen. It used to happen a lot more in the past when we used dilutions of small amounts like 5 ml only in the bottle. Now we use twice as much, like 10 ml, so we have been able to reduce it significantly. And since doing that, I haven't seen any visible lumps. The ones that you can feel underneath, like a little baby into the skin, those I still see every now and then. So I tell my patients that you might get that, and it is not harmful, it is benign, it will go away eventually. It's only collagen stuck in one place. If you don't care about it because cosmetically it's not seen, that's perfect. But if you have OCD or somebody who just can't stand it, don't do Sculptra. Because if you get one, you keep playing with it, it'll drive you crazy. So that's what I guide the patients. And You might go to physicians who will tell you that yes, we can prevent it. Completely not true. We cannot completely prevent it. We can bring it to the stage where it's not an issue anymore because we know where not to inject and also how to inject. But still, you can get a few small ones. So if somebody says, I absolutely do not want a single little lump because I know myself, I have OCT, I'll just keep picking on it, I'll go nuts, then you shouldn't do it. Then I would do like more Juvederm or Restylane or any of those reversible ones.
So how long does it last? And is it that actually your collagen or is it actually the substance that they're injecting in?
How long does it last? 2 to 3 years. And is it collagen or is it the material? It is the actual collagen of the patient. That's why Sculptra is not a filler. It's actually called a biostimulator because it's making you produce your own collagen. Yes. I can hear you. You can speak up loudly.
So Restylane, or however you say that, so are you opposed to that, or do you feel as though that's something as a kind of a quick fix for people that don't want to have facelifts?
Did you say Restylane?
Yes.
Oh, Restylane and yes, Restylane and Juvederm. They are both hyaluronic acids, which are perfectly safe in my experience. They are excellent to use. The problem is when you, let's say, use them for getting a great result, get a facelift type result, you end up using a lot. And that's where the phrase liquid facelift came from. And you end up spending more almost than what you would spend on a facelift. So as long as somebody knows that, there's no harm in using Restylane or Juvederm for doing a liquid facelift to fill up and get the result. Restylane is excellent. I use it all the time.
Speaking of lumpiness, but for a different reason, I've been spending a lot of time on the internet regarding all of this, and there are reports that people experience lumpiness after the surgery. This is not what but they do say that's to be expected in some cases. Can you address that, please?
Sure. Lumpiness after a facelift. So the way the lumpiness works is 2 reasons. One, either that when you're doing the liposuction somewhere, there's a bleeding and the bleeding becomes a hematoma, blood clot, then it finally becomes a scar tissue and it's a lump there. That's one possibility. Or you have left some fat somewhere that you didn't realize you're leaving behind. Those are very easily correctable. Third possibility is that if you're doing, you put stitches, a lot of stitches, and some stitches can get tethered where they just kind of like pull on the skin and might feel like a lump. All of those are reversible and they go away with time. And if you see like 1 or 2, there's nothing alarming. Obviously, you don't want to see like 5 or 10 lumps. That would not be appropriate because you have to have it smooth. And if done improperly, you can have a lot of lumps. That's right. They will eventually go away, but it's a very long period of waiting till it goes away.
So
And that's a poorly done facelift if you see too many lumps.
okay, so is there something that you can do about it? I know they talked about massage, facial massage by a professional.
The facial massage can help, absolutely. And if there's only one area of a lump, you can very carefully put some material like Canalog or mild steroid to melt it down, and then it settles down very fast. Yeah, but you really shouldn't have too many lumps there. I'm talking about visible lumps. If you feel something, that's okay. As long as it doesn't appear like a lump,
Yeah.
then it's okay.
I was picturing kind of.
Well, I have seen some, but those were like, I've seen pictures of thread lift. And with the thread lift, they were putting it just kind of like pulling all the way. You see almost like a trail mark. And it's like lots and lots of lumps. And that is not acceptable.
Yeah, you don't see a lot of the lumpiness.
Absolutely not. In a good facelift, you should not see that. And at the time when you're doing surgery and you put a stitch, you can see that there, where it's going under the skin and pulling, it's going to cause a little dimpling and a little lump. You stop with the suture or you cut it, you do it again. Till you get it right to make sure that now I got it nice and flat. So the surgeon, you're supposed to address that before you finish.
Okay, thank you.
You're welcome.
So tell us more about those threads. Do you do them?
The threads, I do not do threads because I looked into it a lot and I found that they only last for a year, at the most 2 years, and the complication rate was high as well. So for me, it wasn't worth the money for the patient to do that. So, and I'm talking with people who are some of the pioneers of thread lift, going to meetings and asking them to show me the pictures of their patients and their experiences, in a candid fashion. And they said, yeah, it's good for a year too, and then you put some more threads. So I'm like, I don't know if I can keep putting threads every year.
So on the facelift, you said that woman, you did something here.
incisions on the neck?
The incisions on the neck are only under the chin.
Or just
Under the chin. So you go and you make an opening, so you go deep inside under the skin, and then you see the muscle and you work on the muscle underneath the skin.
Okay. And how long are you out for with, like, if there aren't any complications or if it's not a difficult facelift?
1 week.
No, how?
Anesthesia, you mean? About 2 hours. Anywhere from 2 to 3, depending on how expensive it is. And it can also be done without going under. I've done it in the office. If it's a small one, then I don't need to do much. I can do it in the office. With just pure local anesthesia, some Vicodin, and some Xanax.
Well, would that be like just here and here, or like a whole facelift you could?
No, only in the lower face.
Okay.
Only in the lower face, not the full one, no.
Okay.
I have a question. A friend of mine just recently had a facelift, and she looks great, but she's experiencing numbness, and she's a little concerned about that, so I'm curious about numbness in the face.
Sure. It's a very favorite board question whenever we take boards. Like, what is the number one nerve that gets damaged in facelift? It's called great auricular nerve that goes right underneath here to the ear. And if you're not careful, you hit it, the whole lower half of the ear is numb. Fortunately, it comes back in a lot of cases, but in some cases it is permanent. Yes. So you have to wait for 18 months to know for sure if it is completely gone or not. So the good thing is it doesn't have any function in terms of moving the face. However, the numbness is annoying because, especially as women, when you have to put in your earrings, it's like putting earrings in somebody else's ears. You don't get the feedback. It's very annoying. That's the main significance. And also the other significance is that if you're working with curling iron, you can burn your earlobe and not even know. Either I'm very good or you guys haven't paying attention, so that there should be more questions.
I have a comment about the strings. In my family, my father, my brother, and I have hooded eyes that slant down like this, and my brother, who now lives in South Carolina, had an ophthalmologist do something, and he pulled it up with the strings. I think 6 months later, he had to go back and actually do an incision to pull it up. The strings do not hold mountains and buildings and eyes, I guess.
Thank you for that again. I have learned about it from patients as well, that it just didn't work too well.
Can you address how long a facelift lasts, as well as what some of the pricing parameters are on some of the different options?
Sure. How long does a facelift last? Very difficult question, but I've been thinking about it for a long time, and the average is 8 years. But there's a big window, anywhere from 5 years to 30 years. It depends on how healthy a person is, how they take care of their face afterwards in terms of healthy living and continuing to use fillers as needed and staying out of sun. In terms of the cost, I'll tell you my fees. I don't know other people's prices. So I charge $5,000 roughly for the lower face and the neck. If I'm doing the upper part as well, then it's $7,500. If I'm doing it in the surgery center, then they charge a facility fee of about $2,000, and anesthesiologist charges about the same, $2,000.
Did you say just the upper?
Sure.
Did you say just the upper part you can do, or you have to do the bottom?
I can do the face part and the neck, but not the upper part, because then it gets a little bit more involved. And only if somebody's really healthy, then I would do it in the office, in very select circumstances.
Would you say 7,500, 2,000, and then another 2,000 for the anesthesiologist?
Yes. But some of the times I've done facelifts without the anesthesiologist, just with the nurse and giving some, intravenous sedation like fentanyl and Versed, and then you don't need the anesthesiologist, so you save $2,000.
That's for the Lord.
And then for the whole thing, I can do it. I can do the whole thing in the surgery center without an anesthesiologist. Yes. But with select patients, as many of my patients know here, I get to know everybody pretty well. So I know who can, do that, who cannot. Some patients, unfortunately, need to be completely put out no matter what.
Why is that?
Well, we all have different anxiety levels, and you can't control that. I've told patients many times, don't think anxiety is one thing that the more you try to control it, the worse it gets. So you need to know your anxiety level, and that is very critical, because during surgery, then the blood pressure goes up and you bleed a lot more. A simple facelift can become a nightmare because you're bleeding so much because you're anxious. So you have to judge as a doctor, like, how anxious is my patient, and that comes with time. And then you can easily do it. I do upper eyelids in the office, every week, every 2 weeks, all the time. I've done nose jobs in the office, but only the patients I know who can do very well. Some patients I would never do that on. So you have to be healthy and somebody who feels very comfortable. There's somebody here, yes.
The lower part, is that the neck lift, or is there something else that you could do to remove the fat?
To remove the fat, you can do only liposuction. I didn't show here because the focus was the facelift, but somebody who comes in and they have a lot of fat, you can do only liposuction and get a pretty good result. Pretty good result. But if somebody has a lot of loose skin, then you're stuck. Then you have to do a lower facelift, which is almost the same as a neck lift, because the incisions are the same and the pull is the same as well. There's another different entity. I've had a few patients who are elderly and they said, listen, I don't have time and patience and I'm too old to do anything. Can you do something quick? Because they have really a big turkey wattle, and for that you can do direct excision. That is very quick, no anesthesia needed, only local anesthesia. The problem is it does have a visible scar straight down. But for those patients, it is so much better than where they were that was not an issue at all.
Could it be sort of like a scar almost from like a trach?
A bit longer, because trach scar is just a little area. This is straight like a zipper scar.
So it would be a good...
Yes, exactly.
5 inches?
Exactly. Yeah.
And then even with plastic surgery, couldn't just make it so?
It can, it can, but still, sometimes you're taking a chance. Some cases you can't see it at all. Some you do see it, so you have to be aware of that. It's not for people who are still in the younger age group and who can go through a regular neck lift.
I have a question. So you can have facelift done and you still have maintenance, because you're saying you still have to use the fillers.
Yes, it's like you get the engine changed, but you still need to change the oil every now and then.
Right.
That's exactly the fillers. The fillers do the same thing.
So the fillers have to be done on a regular basis then?
Yes, but the need varies. I mean, somebody who's got a fuller face will not really need it. Like the first facelift lady that I showed you that I said was difficult, she's never going to need fillers. But some of the other ones were like really, thin in their face, they're going to need fillers.
Is it going to be, but it's not going to be as much
Oh,
filler?
never as much. No, never as much. Never.
And fillers are usually charged upon how much you use, correct?
Exactly. Yeah. And trust me, they end up costing a lot more with time because, you're doing a lot to try to achieve a facelift result which you really cannot. So. Need more coffee?
You mentioned the incision here, and you were talking also about the neck control here. Like, what really happens in a facelift? Where does the lifting happen?
The lifting happens basically backwards and upwards. So you're taking the whole thing
In which places? Here
right there behind the ear.
and where else?
Behind the ear it goes, so if you can see behind my ear, right there, and then you go right into the hairline, right here. So when you pull it back this way, you can trim the excess skin right in the back and stitch it there. That's for the neck part. Now for the face part, when you put it to the side, then you cut the excess right here, in this area. So you usually have like 1.5 centimeters to 2 right here that you cut, and then you stitch it right here. And then for this part, up in the temporal area. So 3 different areas where you usually cut extra skin.
Can I follow up?
Sure.
Does your hairline move anywhere in all of that?
No, when you do it right, it does not move anywhere. But you're right, there can be a step off. I mean, it can happen, but it should not.
The way you described it to her, it sounds like you're just pulling skin. But earlier you were talking about maybe damaging the facial nerve. So what are you doing underneath besides pulling skin?
If you can imagine that my jacket is the skin, I'm pulling the jacket, that's the number one thing. Second, underneath my shirt. My shirt is the SMAS, which is the fascia, which looks like grizzle, and that needs to be tightened. First, to get to the grizzle part, you lift the skin, then you tighten that, and when you tighten that, that pulls your jowl and everything. After you have done that, then you remove the extra skin.
And what is that second layer?
SMAS, S-M-A-S. And SMAS is just like if you can imagine, thick layer of fascia or grizzle, for lack of a better word, that holds the strings to all the facial muscles. So as you pull it tight first, your face is already tightened. Now you have this extra skin left, and you remove the extra skin.
Okay, so if you're pulling it, how might you damage that facial nerve?
Oh, you won't. Only if you go further in. If you go way deep inside, then you will. And that's what you do in
You mean
deep.
like if you go way into
Yes.
real far?
Exactly. And that's what you have to do when you go for a deep plane facelift. You have to go way further in.
Thank you.
That's
It's not a facelift question, but Voluma, it just got FDA approved, and I just wanted to know what you thought about it.
Voluma is wonderful, it's great. It's from the Juvederm family of hyaluronic acid fillers, and the only difference is it can last for up to 2 years, which makes it really wonderful. And I've spoken to other physicians who've been doing it for a while, and they do say indeed it does stay for 2 years, so that's really great. The other good thing is it's completely reversible, so if there's a problem, you don't like it, you can reverse it. So Voluma is definitely very good. Again, price is an issue. I charge $1,000 for a syringe of Voluma. If somebody says I want a facelift with it, I'll use about 12. So that's $12,000 to do a facelift with Voluma.
And you put that where you put the Juvederm here and these places, not on the cheeks.
Or definitely the cheeks. That's the first place, which is the safest place, yes.
So it's how many times it's more expensive than Juvederm?
Juvederm would be $700 to $300 more.
Is it better than the Sculptra? Do you not get lumps with it like this?
You do not get lumps with Voluma. No, absolutely not.
Okay.
But then you don't have to use it like that as often, so it lasts for 2 years.
Exactly. So once you get the full treatment, you don't have to have multiple sessions. You can have all the Voluma in one go. In one day, you can do all the Voluma, you're good to go.
So one syringe is 1 ml?
1 ml, yes.
12 is a lot.
Depends on the person. I mean, everybody needs different amounts. Somebody might need only 5 or 6, but you really need a lot. Because 6 or 7 cc is not a lot. 12 cc is not a lot. It's just 12 cc, 12 syringes. It's very little. You're a scientist, you should know that. No, but if somebody's face that's silly sunken in, this one cheek alone can be 6 cc's. Exactly. Oh, yes.
So is it safe to say that someone can walk out with Restylane and Botox and look like they had a facelift?
Yes. The question was, is it true that somebody can have Botox and enough fillers and walk out looking like they had a facelift? Yes. Not everybody, but yes, the right candidate can look like that. I have a few people like that in practice.
So if you're just kind of getting started into looking at all of the options, which are kind of overwhelming, some of the people seem to know what cocktails are really well, what's the best first step for someone like that? Is it a consultation and then, because if it's overwhelming, like what the choices are?
Right. The question is like, for somebody who's starting out with this stuff, it's very overwhelming what to do, where to start. I think the best step is to first, just log on into YouTube and search for facial consultation with Dr. Janjua. I have a whole video of that, and when you see the video, it answers most of your questions. And if you feel like, that's something you want to pursue, then call the office and come in for a consultation. We'll sit down and talk. I think that's the most important thing, so you get to know exactly what you need in terms of like facial diagnosis, and then proceeding as to which would be good for you. Because I don't have a cookie cutter approach, and everybody's so different, so I have to tell them what is going to work for them and what will not work for them.
How much is the consultation?
$150.
For an hour?
Yes.
You mentioned costs for the facelift, but sometimes you said lipo would be needed additionally. What's the extra cost?
No, lipo is always a part of my facelift. I always start with that as part of it.
And when you just do the lipo, what's the cost?
Don't hold me to it. I think it's $2,500. What is the cost of liposuction? No questions off table.
Does the consultation fee go towards the facelift?
Only for like you. Yes. Yes, it does. And if you're an existing patient for any reason, then there's no cost. You can come back as many times as you want.
So does it also go for the Restylane or the Botox?
Absolutely. And actually, I have a filler day coming up, June 12th, which is a special filler day, 25% off all fillers just for that day.
You mean we'll have to show up that day?
No, you don't have to. You can call in and say, listen, I'm going to just buy it on phone today and I'll come back later and have it done. But you have to buy it that day. It's our filler day. You can call me and I'll tell you. I remember the faces of all my patients. Not that I'm saying you're my patient, but...
Did you send that out in the email?
I did. Check the junk box.
What if does, if you've had some of the procedures and then you've lost, say, 20 or 30 pounds, what impact does that have on the procedure that you have done?
If you have a procedure and then you lose 20, 30 pounds, typically very little. You might get some loose skin in the face, but not to the point that it would be noticeable. Now, if you did like 60, 70 pounds, then you might need a little bit more skin excision again. But 30 pounds, I don't think you'll notice anything. Are we including Voluma in discount? Yes. All fillers. That includes Voluma, Juvidum, Radius, Restylane, Sculptra, Bellotero. Bellotero is a newer one. It's like Juvidum and Restylane, but it has one advantage. If you put it too close to the skin, it will not show a color. There's a phenomenon called Tyndall's effect where you see a bluish discoloration with Juvidum or Restylane if it is too close to the skin. Bellotero doesn't do it, so it's very good for areas like the upper lip skin where you have to be very close to the surface.
So it's used where? In which areas? That important.
Bellotero is used in the upper lip where somebody has like fine vertical lines. You can go directly in the line and it gives a better result, whereas Juvidum and Restylane might show like a bluish discoloration. That's where it works the best.
So which product is used in the eyes area and
In the tear trough that runs this way, I like to use Restylane, but you can use Bellotero as well or Juvidum. I have always used Restylane, I'm just comfortable with it, but you can use either of the three. And if you're talking about the cheek and the lateral, the side part of it, that's where you need more volume, so that's where I like to use Sculptra or Voluma.
How common is it to get broken capillaries?
How common is it to get broken capillaries from injections? It's rare. I mean, some people have very fine porcelain skin. They get a needle anywhere, they might get one, but typically not very common at all. So for most people, no. I maybe get like, one a year somebody tells me that I broke out in there, but typically not.
Would they get laser for that?
There's IPL, that's here, we can just IPL the spot and it goes away.
Your course is easy, and if everybody wants to know what they need, do you check email? Is that how?
Oh yes, yeah, you can send an email.
Is there a way to communicate with your questions?
Send an email. That's the easiest way. I mean, you can call, leave a message, they'll answer the phone, and if you want an email, send an email. Our email address is, I think, listed here. I'm going to bring it back so you can see the email address right there, and you can write it down if you want. I think you had a question.
Can you talk about eyelid surgery?
Eyelid surgery, yes. I mean, I was planning on doing a whole seminar on eyelid surgery down the road, which I will, but very briefly, eyelid surgery is the #1 surgery in my practice because typically the eyes go first and the upper eyes go before anything else. You get extra skin, eyes start looking smaller, and then when you can't see your eyeshadow, you know it's time to get the upper eyes done. It's a very simple, straightforward surgery. It takes about half hour to 45 minutes in the office. Your downtime is 5 days, and it's my favorite surgery because it's so easy. I don't have to do a lot of thinking, that's why.
And what's the cost?
It is $27.50.
That's upper and lower?
No, that's just upper or lower.
So with the eyelid surgery, if you have the eyes that the ophthalmologist has already deemed that they're below the pupil and it gets covered under insurance for the top part, now do you have to cut the muscle for that? That type of, is that different from just the regular eyelids to open them up?
Sure. There's eyelid droop where the eyelids come down below the pupil. That's called eyelid ptosis. That's very different than this cosmetic surgery that we are talking, which is called blepharoplasty. That is called ptosis repair, and that insurance covers, and it's very, very different.
And that's where they cut the muscle. What if I didn't, right? That's where they cut the muscle.
They cut the muscle in that, and then they have to tighten the muscle to bring the lid upwards.
But could you, if I'm deemed, to have that type, but I don't want to because the risk of the muscle and competitive surgeries, could I just have the other one instead?
Can you have the other part, the blepharoplasty, if you're either very droopy and not have the ptosis repair because you're afraid of the muscle because it's delicate? Yes, you can do that. But typically those patients do have extra skin and insurance will cover it in some cases if it's extreme case.
Well, then it wouldn't really be covered under insurance, but I just wanted to know if you could have that other.
Oh yes, yes you can. Absolutely.
About being covered under insurance, back to my brother again, because of the upper flesh on the, up above the bone, it was covered by insurance for him to have it lifted this way. So if it's impairing your vision, you might be a candidate for anything to help open up and widen the opening. I'm going on Monday to find out. I am.
Any other questions at this time? Yes.
What about dark circles?
Dark circles. Dark circles happen from several reasons. The most common reason is the bulging fat in the lower eyelids, which casts a shadow because most lights come from above, so it casts a shadow on the cheeks, so it looks like you have bags. If you're in the very early stages of the bags, then you can get a filler underneath the bags in the tear trough, and that will kind of hide them, and that works very well. If it is late in the game, then you need lower eyelid blepharoplasty, where the fat and some of the skin is removed at the same time.
Financing, would you offer care credit or anything like that?
Financing, yes. We participate with Care Credit, and for people who don't know Care Credit, it's a company, financing company owned by GE, I think, who is involved in cosmetic stuff, and also with dentists and veterinarians, and they work with offices and they charge us fees so they can offer good interest rates to the patients, and they're very easy to work with in terms of getting financing for any of the procedures. The bar is going to close soon. The last call is coming. Better start thinking. Well, if there's...
Does microcurrent affect fillers or fillers? How often, when, not to?
Sure. Does microcurrent therapy affect fillers? I honestly don't know the answer, but based on my knowledge of anatomy and physiology, I doubt it, because, it's no different than the movement that happens in the face anyway. Anywhere there's more movement, you will lose the filler faster, like lips. Anywhere there's no movement, for example, under the eyes right here, it'll last for a very long time. I've seen Restylane last for up to 2 years in here, while in the lips last for 4 months. So microcurrent, I would keep doing it, I wouldn't worry about it. That's only if you think it's helping you. If it's something like a therapy, then